In spite of being equated with negative health outcomes, poor sanitation still remains a major challenge in the 21st century. The ever-expanding megacities have a never-ending demand for clean water. This water is often sourced from hundreds of kilometers away for most of our cities, and after use, this water is discharged into rivers without any treatment. This is turning our rivers into open sewers, and hence the twin challenges of water stress and climate-induced intensification of water cycle are adding to the burden of our already poor status of water and sanitation infrastructure. On top of this, we also have large informal settlements that are intensifying the problem further in terms of their water demand and wastewater discharge. So according to CPCB, the Central Pollution Control Board, wastewater generated in India currently is around 70,000 MLD, million liters per day. And the cities are poorly equipped to deal with this wastewater. So let's find out what is happening. If you see, our systems of sanitation are flush and forget systems which have been, taken from developed countries. They are dependent on large volumes of water which are required to ensure this flushing happens. In spite of these systems being in place, they require extensive operations and maintenance, repairs, because these systems get clogged. The situation is far worse in our dense informal settlements where we don't have basic infrastructure. So the irony is that our dense informal systems have what we call as non-sewered systems, which are not connected to sewers, whereas our affluent colonies or our planned colonies have sewered systems. As per the census of 2011, out of the nearly 8,000 cities, only 10% cities have sewered systems. The rest, and that are also partial sewered systems. The challenge of sanitation for urban India is that our cities are growing. We are expanding cities, our populations are increasing because of migration and several other reasons. So what we need is a combination of systems that will reach both the areas which are planned and privileged and those which are on the periphery. Second issue for urban sanitation is that 40% of India's land area, not the urban area, is in the semi-arid and arid zone. Issues of climate change and the water stress, they combine to make sewered system a less attractive option. Going forward, more decentralized systems, non-sewered, should be preferred based on the local context. We say that because decentralized systems are less resource dependent, or even non-sewered systems of transporting the sewage or septage to a treatment system. Decentralized sanitation systems are also more equitable and just in terms of any kind of settlement, privileged or poor, having access to these treatment systems. Another advantage of decentralized sanitation systems is that the waste processed through the treatment can be reused locally and can be effectively reused, both treated wastewater as well as biosolids. Since 2017, India embarked on a national policy for fecal sludge and septage management, under which more than 500 fecal sludge treatment plants have come up in India in different states. CSE has done a study of 69 such fecal sludge treatment plants in 22-23. The fecal sludge treatment plants in India which have been built are found to be as effective as the septage treatment plants in terms of treatment of wastewater, which is usually assessed through BOD and COD levels in the treated water. The real challenge of making our fecal sludge treatment plants function or operational is the challenge of getting adequate septage on a regular frequency to these treatment plants. And that is not because there is not enough septage, but just the issue of taking the septage out of the septic tanks and the household level and bringing them to the treatment plant. That remains a major challenge. So let's discuss what needs to be done to address the issues of urban sanitation in India. As we have said, we need a combination of all treatment systems, centralized, decentralized, seaward, non-seaward. What is most important is that these treatment systems are planned for each state and city with a long-term perspective, preferably of 20 years and more. Because unless you can plan it in that manner, you cannot ensure that you can use your resources most effectively. Now, the treatment standards have been traditionally set to ensure that our water bodies and rivers don't get polluted with either industrial waste or human waste. Therefore, the standards are very much linked to the pollution of water bodies. They are not linked to the issue of reuse of the treated sludge, and therefore the standards need to be set in such a way that they qualify for reuse and are not so stringent that they have to qualify for the water bodies. So the immediate priority for us is that fecal sludge treatment plants, wherever they exist, they should become functional and operational. And for that, what is most important is that desludging happens. And desludging can happen only if desludging is incentivized and provided for either as a public service or as a private business. We should go for decentralized systems as much as possible, and CSE has actually propagated it in the last 15 years or so since the last 5-year plan was formulated. The last priority would be the capacities of our institutions, because most of our technical institutions at the state level, national level are very engineering focused, and their engineering is on centralized sanitation systems. So there is a big need to fill a gap, capacitating our officials, our policy makers, and of course our technical staff in designing decentralized as well as non-seaward systems.